Next, I would like to invite Dr. Hirika to present on AIOC, a perfect surgical Digi logbook for every resident. Dr. Vinod Kumar Arora and Dr. Thomas Cherian are the discussant.
So I'll be talking about AIOC, a perfect surgical Digi logbook. So let's all go back to our first day of OT, our first cataract surgery. I'm sure all of us will be really anxious, adrenaline rush, and a lot of trembling in the hand. So you would also fear what your trainer would think about you after the surgery. You need more practice. Your tunnel wasn't correct. You're putting too much pressure on the globe. You need more wet lab practice. So yes, obviously, but the important question is, how did we perfect those surgical steps and tackle all our complications? So, as a first year resident, I was told by my mentor to maintain a logbook. So, I wanted to do it using my iPad because it made things more easy. So, which is equivalent to an Excel sheet. I use the numbers app wherein I used to enter all the patient demographic details and the details of the surgery, what cataract grading, the pre-op vision, the post-op vision, and the complications, and intra post-op complications, the post-op vision, and what were the steps that I assisted, the steps the trainer assisted me for, and who assisted me. So initially, I was having a lot of complications, and slowly, when I started using the logbook, I realized that I was actually improving because I could review back on what was happening, what was a step that I really need to work on. So later, my complication rates reduced, and it really helped me grow in my surgeries. And also, we used to do the Oscar grading, the ICO ophthalmology Oscar grading, wherein we used to print the sheets and we used to ask our trainer to grade us after whoever has looked at the trainer who looked at the surgery when we were operating. So it covers from the first step of the SICS, from the draping to the the cauterization, to the tunnel, to the rexus, to the nucleus extraction, to the lens insertion, and to overall speed, fluidity of and they used to also comment and give us a score. So it was a tedious job overall. So this hackathon which happened in Arvind Eye Hospital, I found Scrubbook, which is so you can see here how Scrubbook works. So Scrubbook is a web page app wherein the trainee can register, log in, and add all the patient details. It can be the demographic details, to the name, the age, and all the date of the surgery, place of the surgery, and all the details required, complications, pre-op vision, post-op vision, astigmatism. He can also add the surgical link, the steps assisted, and any comments by the trainer. So also the trainer can log in, and he will have the trainee ID, and he can use the trainer login to actually grade the trainee, whoever he's added the employee ID of, and he can grade the trainee according to the video link, or if he's seen it, with the Oscar grading. And then the trainee can actually see what the trainer had to grade him accordingly. So this was a very early stage of the app that we are working on. So it is a handy go-to app for every resident, which can be used as a digital surgical logbook. It can store patient data, it can record and can be searched by the trainee at any time, at any place, and all complications can be reviewed at once. The complications can be moderated by the trainer. It can be reviewed on the app, and also you can see the Oscar grading. I'm working on the future prospects of introducing statistics for all complications, to insert an alert notification on exceeding complication limit or recurring complications, then surgical lessons by experts for complication management, and taking it beyond cataract surgery and for other specialties, and to hire expert surgeon to advise to grade the trainee cataract surgeries. So concluding, I would like to say it's a web page app which can be used by residents, fellow consultants, anybody who wants to actually want to review the surgeries. So it is available now. You can all check it if you want to. Thank you.
I think it's a good idea to review yourself, and it improves our working also, and we know how much we are progressing. I think it's a good idea, but it's available easily
Yes, sir. You can use it.
Anybody can use it.
Yes, sir. It's
Yeah.
the web page app. I'm working on the app. As of now, it's a web page app. It's not an app directly. You have to Google it. So
And-
you can use the link over here, but the app is, I'm working on it. So
And
it will be
I
an
think
app.
it can be customized by the resident himself or herself.
Yes, sir. Yes, sir. So mainly it is mainly about how your train. You can also ask your trainer to see your video. You can put the video link also to review for the trainer.
So it provides a common platform to trainee
Yes, sir.
and trainer. Right.
Hirika, it's an excellent tool. One or two suggestions.
Yes, sir.
Your alerts mode, that is something very good. But then your consultant or your trainer should also be able to insert some warning signals.
Yes, sir.
If you as a trainee is having some complications which he wants to alert you, then maybe when you open that or when you go into that case, that particular insert should also pop up.
Yes, sir. We are, as of now, he can add comments. So we'll surely make it like an alert option or something. Thanks.
Thank you, Dr. Hirika. You can collect your certificate.